It's not known where the patients got the virus, but officials say they didn't travel to a place with coronavirus. They didn't come into contact with any traveler or an infected person. So we're waiting as well for the CDC to confirm at least 3 presumptive positive cases. Presumptive meaning that the person's been tested by state health labs. There is a confirmation test required, however, to be done at the CDC before it's official.
Now, 2 of those cases are in Washington state. One is a woman who recently traveled to South Korea. The other is a high school student with no travel history. There's also a presumptive case in Oregon. That case is an elementary school employee whose school is now closed until Wednesday for some deep cleaning.
We don't know the number of close contacts being within 6 feet for a prolonged period of time that this individual had. We don't know how this person became infected with COVID-19. It's too soon to say what impact this case has on family, friends, coworkers, or the Lake Oswego School District and other members of the community. Contact tracing is our top priority right now.
Alrighty, and with us now we have Dr. William Schaffner. He's an infectious disease specialist at Vanderbilt University. Doctor, thank you so much. It's good to have you back with us. Late last night, the CDC, or late yesterday, the CDC released a statement saying that they want local and state health departments to test for the coronavirus by the end of next week, essentially 1 week from today. What exactly do they mean by that? Do they mean they want every person tested? Do they want just health officials tested who maybe have been dealing with some of these patients? What exactly is their goal?
Well, I think what will happen, Chrissy, is that the test kits will be out to the state laboratories, and I think the CDC is saying the restraints that we've had on testing can be relaxed somewhat, and if a physician sees a patient that they're suspicious of, then go ahead and test. So we're all very receptive to that. We've been wanting to test more broadly for a while.
And there were problems with the testing that was sent out. They were flawed tests. Are you confident in what's being sent out now?
Well, we have high hopes, of course. The CDC has done their best to fix the problem, and we're looking forward to testing more frequently and probably finding more cases, I'm afraid.
What is your thought process on the potential vaccine? We know the head of the World Health Organization says right now they're developing more than 20 potential vaccines in labs all over the world. How soon, maybe before we get those test results, and what kind of timeline are you looking at for something that might actually be a usable vaccine?
So let's think about what it takes to develop the vaccine. First, in the laboratory, you actually have to construct the actual vaccine, but then you have to test it in a series of studies in people to make sure, first of all, it's safe, and of course, that it will work. Those processes take time. I think we're easily a year away from a vaccine that can be manufactured and widely distributed.
What do you say is necessary now in some of these communities? It started in San Francisco with this one patient who had what they call community spread. There was no indication that she had traveled overseas or had had contact with anybody who had the disease. What does that mean for those specific communities?
Well, I think what it means is everyone ought to be cautious, staying away from people who are coughing and sneezing, do a lot of good hand hygiene, and I think in those communities, people are starting to avoid mass events, crowds, kind of retreat a little bit and let the story develop. Listen carefully to your local public health authorities.
At the end of the day, Dr. Schaffner, how dangerous do you think this could be?
At the end of the day, I think this could widely spread in the United States, and we're all preparing for that eventuality. We can hope for the best, but we have to prepare for something more serious.
And are you confident in that preparation?
We're all confident up to a point, but we know pandemics, very large epidemics, can stress us all. We all have to work together on this.
All right. Dr. William Schaffner, always a pleasure to have you here. Thank you, sir.